From Chicago's Can TV, a look at the week's events is reported in the newspapers, in the blogs and online, and on radio and TV. This is Chicago Newsroom.
Well, hi there, and welcome to another edition of Chicago Newsroom right here on Can TV. Things look a little different, we'll explain in a moment. But first of all, it's that weekend, isn't it? It's that couple of weeks between New Year's and Christmas, and we want to wish you, if you haven't already had one, a very wonderful and warm Christmas and a terrific 2017. Let's hope that 2017 is, it's going to be a challenging year no matter what. We all know that, but let's hope that at least for you and for us, it's a great year, huh? For many people, though, 2016 wasn't such a great year. For almost 1 in 6 people who live in Cook County, they really didn't know at the end of the pay period whether they were going to have enough money to feed the family the way they wanted to feed the family. And this is a thing that we really want to focus on our program here today, and that's why we are where we are. Nicole Robinson, welcome to Chicago Newsroom. Glad to have you here. We're at the Chicago Food Depository, Greater Chicago Food Depository, which is a massive place on the southwest side. What do you do here?
Thanks, Ken, for having me. I'm Vice President of Community Impact at the Greater Chicago Food Depository, and basically what that means is I help lead our programs, strategy, and public policy, and help us connect our neighbors to food across Chicago and Cook County communities.
Now, that sounds a little formal to me, okay? That sounds like something that you'd read on an annual report or something. On a day-to-day basis, what is this connect? How do you make this connection?
Oh, thanks for asking that. So as you mentioned, I want to talk a little bit about the needs. So you're right. There are 1 in 6 of our neighbors across Cook County who face hunger. Mm-hmm. That's actually about 812,000 people, 15% of the population in Cook County. And just for context too, 30% of that need is actually in the suburbs as well as across the city. And it's emerging in communities and neighborhoods across all of the city. So it's not just something that's isolated to 1 or 2 or 3 neighborhoods across Cook County. It's something we see popping up everywhere.
I think we really do get a kind of a sense of that. I mean, we've all heard these stories about how, you know, more and more people are working 2 jobs. They're working for minimum wage, which, as we all know, can't even begin to support a family. And, you know, we get to that point, don't we, where something has to give, and one of the things it has to give is the kind of food you can provide the family.
That's exactly right. Families are making trade-offs. Mm-hmm. It's a trade-off between, you know, paying rent and getting healthy, nutritious food. Mm-hmm. Do I pay my light bill or my heating bill, or do I have enough money to, you know, pay for my prescription as well as have the food I need to take with my medicine? So those are the kinds of trade-offs families are making. And there's a myth out there that many of the families who face hunger are homeless, but that's actually not true. Many of them are working, and 50% of them have worked at some point over the past year, and 90% of them have a place to stay. The question is, to your point, is it meaningful employment with benefits and a living wage so that they can actually afford the food that they need?
You know, I think there are going to be a bunch of times in this conversation today where I'm going to want you to say it again, because these things just kind of flow by us, you know, like a river. Mm-hmm. You just said 90% of the people who are food insecure are not homeless. They have a place to stay.
That is correct. But if you're in a 2-parent household, and you're working low-wage jobs, you may not have enough to just provide for your family. Mm-hmm. So that's part of the challenge that a family has. So it's not that people aren't working, it's that do they have that meaningful employment so that they can afford everything they need, including the nutritious food that they need. And that's where the food depository comes in, because we were set up about 37 years ago to be an emergency food system. So we weren't meant to be a permanent solution, but an emergency system. And unfortunately,
the emergency persists.
Right. The emergency has gotten more acute, you know, particularly after the recessionary period. So that's where we are today. And what we do, we don't do this work alone. You're right. We're in this huge facility. It's about 268,000 square feet. Mm-hmm. So it is big. But what we do is collect and distribute food. And many of our donors are corporations, grocery retailers. We receive government commodities. We also purchase a fair amount of food because we're really committed to the nutritional mix of our food. 70 million pounds of food comes through this warehouse every year. It's a big number, but it's only a drop in the bucket in terms of the need. 35% of that, which we're really proud, is fresh produce, because what we've also learned is that many of the families that show up to the food pantries, kitchens, and shelters that we partner with have other health challenges, whether it's diabetes or hypertension. So we're really committed to having a great nutritional mix. Fresh fruits and vegetables, rice, beans, meat, the proteins that families need. So we're completely committed to that. But this is really the foundational work. You're sitting in the foundation of the food, but really if we're going to end hunger, it's actually our work is through partnership and collaboration across all the neighborhoods across Cook County. And that's and I want to talk to you a little bit about our strategy and how we do that.
Yeah, well, let's do that. But also, I have a feeling that people who are watching the show are thinking, where are we? You know, give us a sense of this. So let's look around. I mean, this is, as you say, this is what, a couple of 100,000 square feet of storage or
over 268,000 square feet.
Yeah, and at any given time, I mean, we can see that over here there are dock doors where trucks are coming in and I presume going back out. But food is being kind of just centrally moved around in here.
Exactly. We have a fleet of 50 trucks that pick up and distribute food across Chicago neighborhoods and Cook County neighborhoods. And this facility is where we store a lot of the food. You see a lot of shelf staple items on the racks. And if you see that white building in the corner, that's actually where the cold and refrigerated items need to be stored. Okay. So that's a key component because, as I mentioned, 35% of what we distribute are fresh food items.
Well, you know, I want to go back to that because this is all part of a much larger story, isn't it? I mean, it's the story of America in 2015, 2020. One of the biggest problems that we have in this country is access to health care. Which maybe was starting to be resolved with some of the Obamacare stuff, but that may be going away, we just don't know. But healthcare ties into diet and ties into access to quality food. I mean, it's all part of one thing.
No, thank you so much for mentioning that, Kim, because that's that piece around the clients showing up to the pantry, soup kitchens, and shelters with other health challenges, hypertension, diabetes, and what we've been able to do most recently, our most innovative partnerships have been with healthcare providers. And one example of that is with Cook County Health and Hospital System. And what we're doing is we're meeting clients where they are, which is a foundational piece of our work to connect with communities. So we are the medical staff at the Cook County Health and Hospital System. They're screening patients for food insecurity. So when they go to the clinic as a part of the intake process, they're asked 2 questions that will determine whether or not they are food insecure. If they screen positive, they're referred to the Food Depository network of pantries. We have over 450 soup kitchens, shelters, and pantries that we partner with. The other interesting thing, which I think is the most innovative part, is we're actually bringing one of our trucks full of fresh produce. It's called the Fresh Truck, and we bring that to a clinic. So we're meeting the client where they are. So when an individual, instead of having to go to another pantry at another location, they can actually come to the clinic where they're being serviced by their doctor and pick up fresh produce. It's really amazing. And what we're complementing that with is nutrition education. So not only do they pick up the fresh produce, but they're getting a recipe on how to prepare squash or that kale. Some of our clients have never tasted kale before, so we're introducing them to new vegetables and providing all the ingredients. So it's really a wonderful thing.
So I'm a little bit confused here.
Sure.
Do you guys do the last mile stuff too? Do you actually hand the food to the people who are going to eat it, or do you partner with all these other organizations that actually distribute the food to the people.
And that's what we do. That's why this is just the beginning. The 50 fleeter trucks that we have, we deliver food to over 450 soup kitchens, pantries, and shelters across the city. And that's where the men, women, and children that we serve will show up to receive that bag of groceries.
And you said that your sources of the food are donations, and some of it is purchased, and some of it is government. So you've got a whole mix of stuff.
We have
coming
a whole
in.
mix.
I want to focus a little bit on the purchase, because that's money that people are giving you, right? You have
Absolutely.
members. I know. I've been one for a long time. So, so you get my few bucks every year. Where does that money go? What does it buy?
It buys some of those. So we talked about those staples because we're really committed to offering families a balanced diet. So that idea of rice, pasta, vegetables, we supplement the donations that we receive. So we're receiving from corporations, from growers, farmers, but we sometimes don't know exactly what we're going to get. And we balance that mix out by going out and purchasing items that we know families need. We know it will provide them with the nutrition, so it really balances out the diet.
So you might get a call from somebody saying, "Hey, I've got 12,000 cans of pureed pumpkin or something,"
and we'll take it.
And it's getting close to expiration date. We're going to have to throw it out if we don't use it. So we're going to give it to you, and then you've got to figure out what to do with all that pureed pumpkin, and it's not even Thanksgiving.
Exactly. That's a great example of what will happen with our corporate donors or some of our grocery partners, but we do supplement that because peanut butter, the rice, the pasta, we know those are the staples that people need.
Yeah, and so you're always purchasing that kind of stuff.
Exactly, and we often have volunteers come in and help us sort through that. Actually, the area right there in the back is where we'll have groups of volunteers come in. So if we get a big load of beans, it's in a massive tubs. We just can't, the way that we get that to all of our partners in the community is we separate it out in small bags. So we'll have groups of volunteers come in and do that work, and that's invaluable. We can't pay for that. That's invaluable work. So we love the thousands of volunteers that come through in the food depository, and they come. They're donors. Sometimes they're recipients. The folks who stand in the pantry lines often come in and volunteer.
Yeah. I'm always reluctant to talk about numbers on television because, it's very hard to sort of conceive it. But I really want to go back to them a little bit. Can you give me sort of a broad overview of, you said the number already went through my head too, how many pounds of stuff goes through here at a time?
70 million pounds.
See, the problem with that is that's just a number. I can't imagine what 70 million pounds is, but I mean, that's got to be a lot. If you could put it all in here at one time, I mean, it would be probably many, many times the size of this building.
And this building has a capacity to go about 80 million pounds.
Oh, okay. All right, good. All right. So this is how much you're pushing out into the community every year.
Yes.
And can you tell me a little bit about these you said there are 800,000 people, right?
800,000 people.
800,000
They're
people.
men.
And we're only talking in Cook County. I mean, I can't conceive of this to me.
They're men, women, and children. Some of them are veterans who have not been able to piece things together and have a job and meaningful employment. So to actually address that population, we have 2 pantries in veterans hospitals. So that's about meeting people where they are.
That's pretty shameful, but I'm glad you're doing it. Yeah,
it is, but it is a part of what we do. It's children. 20% of that 800,000 that we talked about are children facing hunger. So children who come to school hungry, they can't concentrate on doing their work in class and can't be attentive. They struggle to do their homework. And hunger is a distraction, and that is probably one of the things I just feel most passionate about. Is that's one thing a kid should never have to worry about, where their next meal is going to come from. We know that in school, kids can have access to lunch and breakfast, but when they're out of school, summer is one of the most vulnerable times for a kid because they're not in school. We don't know when they're going to get a meal. So one of the things that the Food Depository does is help connect kids to meals in the summer. So we provide meals and we partner with community organizations in the summer and bring meals to kids, prepared meals.
That is such an important point. And again, these are things that we're just not even thinking about. We all know that, the schools have a breakfast program, or there some kids get fed in school.
Yeah.
But what about those times when they're not in school and their family situation hasn't changed just because it's summer?
Exactly. And one of the other most powerful tools that we have when we think about families, because we talked about the two-parent household and they're working and they don't have enough to make ends meet. Sometimes what families can qualify as something called SNAP, which is the Supplemental Nutrition Assistant Program. It's a federal program paid for by the government, and families that can be income eligible can get a SNAP card, or food stamps is what it's sometimes called, and they can go to the grocery store and be empowered to buy the food that they need. And that goes way further than even what we can provide in the food bank. So what we do as well is help enroll families in that program. And that's another key part of our strategy.
So how does, I'm still curious about your job, because it seems like you have really a fascinating job. I mean, you get to see a lot of
what the best part of my
but
job is actually helping connect families to food and finding unique ways to do that.
Yeah.
And one of the unique ways we talked about is having bringing our fresh truck to a health clinic, and that's where a family can access food.
Yeah.
The other interesting thing we're doing is we're putting pantries. We have 30 pantries in Chicago Public Schools.
In the schools?
In the schools. So that's a way of that concept of meeting, families and communities where they are. And there's so they don't have to go another place. So teachers, parents, administrators, they all get together and they support the pantry and the operations. Because there are a lot of these pantries that I mentioned, all these partners across the city, a lot of them are volunteers. They have small budgets, if they have a budget at all. They have volunteers that show up and give their time. So that's so powerful. It's community helping community, which is one of the great things about Chicago.
So a parent who brings their kid to school can stop at the pantry on the way home and pick up some nutritious food.
Exactly.
That's a good thing too. I'm going to keep coming back to this point because I just don't believe that most people get this. And so we're going to say it many times until it settles in. 800,000 people would be a fairly large American city. I mean, you never do math live on television, but I'm thinking that's probably, isn't that about the size of maybe Cleveland or something? Is 800,000 people? I mean, they're just under 1 million, I think.
That's a good guess.
Apologies to Cleveland if I got that number wrong, but okay, let's look at Rockford. I mean, it's way bigger than the city of Rockford. Okay, let's stay in Illinois, okay? It's bigger than the city of Naperville by far. You could probably put both of them together. That's how many people live in Cook County. Not in Illinois, in Cook County.
Right.
Who are food insecure, who do not have an adequate access to the food they need for their family at the end of their pay period.
That's correct.
What's wrong with us? You must know the answer to this. What's wrong with us? How can this be?
Well, what I do know, part of the challenge again is just families having meaningful employment and work and being able to support themselves and not having to make those hard choices between paying rent or paying for utilities or being able to get their medicine. So that's part of the challenge. I think part of the opportunity that we also play in the Food Depository is we have a workforce development food training program called Chicago Community Kitchens. So as much as we're committed to helping connect families to food, we're also committed to helping connect them to work. And this program is amazing. Hopefully if we have time, you can take a look at the kitchen. But it's a 12-week food training program. And when individuals graduate, we place them in a 2-week internship in the food industry. It could be at a grocery store, it could be at a restaurant, it could be at a catering company. And once they finish the internship, they're placed in permanent employment. We have a 90% placement rate and a 70% retention rate. And as a part of that program, individuals learn knife skills, food preparation, and food handling. The food that they're able to create is amazing. They learn how to work all the commercial equipment in the kitchen. So it's really, we're addressing that skills gap that again puts people in meaningful work so that they don't have to make those hard choices about food. So I feel like in the food depository strategy, it begins in this warehouse and connecting people to food, but we don't want to do this forever. We want to put ourselves out of business. So that's part of the program. That's part of the process. And I think that's what, again, folks across Chicago and Cook County, that's what makes this work great, is how we're all coming together. So you're right, 800,000 people, food insecure, that's too many people, and that number has grown since we've been in business, and we want it to stop growing. And part of the solution will be community coming together, collaborating, and we see that when volunteers come through our doors and when donors like you contribute to the food depository.
Well, it's really interesting because we wanted to come here and do the show on location so that we can all see this in the background. But I think you would say, I'm putting words in your mouth, and I would agree with you if you said this, that the story isn't about this warehouse. It's not about this facility, because this facility exists because of the mega issues that are outside it, and it's out there, shoveling away, trying to do its part. But our program is a political program. We talk about politics, and I'm not going to drag you into the politics. But the solutions to these problems are political. And they are, so much of what we hear from from some of our current political leaders are things like poverty is the choice. You choose to be in poverty. If you wanted to work a little harder, you might be able to provide for your family. To which many people respond, yeah, I could work a little harder if maybe I could get that third job that pays $9 an hour, then maybe I could do a better job. This is not a question. This is just, I'm just ranting here, because being here, actually, at some level, I have this dual response. The first is how proud I am of what you're doing, and the other is how angry it makes me at the inability we have as a culture and a society to have already solved this problem.
Right, and I appreciate you venting and sharing that with your audience, because we want people to be angry about our neighbors facing hunger. We don't want to become complacent, and we shouldn't. Right, so thank you for doing that. And I think that there's a role that we can all step up. I hope that we channel that anger and frustration about what's happening in Chicago neighborhoods, because we're a tale of two cities. There's a lot that we love. I'm a lifelong Chicagoan. I'm a product of Chicago public school system. I love Chicago and the opportunity it has afforded me, and I want my neighbors to have that same opportunity. We just need to bridge the gap. And I think that's part of the role that the food depository is playing. The 450 soup kitchen, shelter, and pantry leaders, these community-based leaders who are volunteering their time to open a pantry, to serve people a hot meal. They're gearing up to do that right now for the Christmas holiday. It's all of those folks working together, the volunteers who come through our doors, the corporate donors who give us food and financial contributions, the individual donors. That's a movement, and I think if we can channel that anger and invite other people to become a part of this movement to end hunger in Chicago, we can do it.
Well, why don't you take advantage of CAN TV right now, and let's figure out how people can come here to volunteer, how people can donate. I don't know if that's all the same. If that's the same funnel, but we'll put it up on the screen.
Sure. chicagosfoodbank.org is our website. I would invite everyone to visit that website, and you can learn about volunteer opportunities. You can come by yourself. You can come with a group. As a volunteer, I'd invite the whole CAN TV team to come out and volunteer as a group. You can also volunteer in the community. to see what that looks like, to see what a distribution looks like at a health clinic or a pantry or a soup kitchen, to really, you know, because we serve our clients with dignity, and part of that is connecting with clients. At that same link, chicagosfoodbank.org, you can also make a financial contribution. For those of us who are busy and don't have the time, you can make that contribution to actually purchase some of those fresh foods that we need, the milk, the dairy items that a family needs, the protein, the rice and the beans. So those things we all purchase, and we need support for that as well. So, and the other thing I'd add is this time of year, in November, December, we have over 500 food drives, and anyone can start a food drive. So that's also a great way to volunteer. Start your own food drive or participate in the hundreds of food drives that are happening across the city.
Nicole, I'm just so glad that we were able to spend a few minutes here with you today, and I know you got to get back to work, but you know, I have, as we were talking, I just have this image of the parts of Chicago where the giant food chains are competing with each other 3 or 4 blocks apart to build these emporiums that you walk into, and they're competing on how many varieties of cucumbers they can stock. And you can go 6 blocks from there, and there are people who wouldn't be able to access that food no matter what. So it's a good thing that there are some people who are trying to balance that out, and I'm proud to have been here with you today. Congratulations and good luck to you.
Thank you, and thank you for being a part of the solution.
All right. Well, there you go. There's Nicole. She works here at the Chicago Food Depository. Nicole Robinson, I'm very happy you invited us here today, and thank you for that. You have been watching Chicago Newsroom on remote from the Greater Chicago Food Depository warehouse down on the southwest side. And we'll be back in the new year with a bunch of new programs. We're going to start off on January 5th with a big blowout program about the news media, and I hope you'll be able to watch that one. And we're looking forward to a great new year, and I hope you are too. Happy 2017 to you from all of us here at CAN TV. And thanks Chris and Carrie and Rob for coming out here today and setting this up, and for all of the things that they've done for us on the show up to now. I'm Ken Davis. By the way, you can go to this address if you want to see our show at any time. And we'll see you next year. Bye.